Hi, Dr. Patterson here. And in this video, I'm going to talk about a topic that is old, but is very pertinent. And I'm looking at this, I'm going to read to you this study. It's an old study, but is something I think you should know about in terms of the leading causes of death. As you know, cardiovascular disease is number one. Number two is cancer. And number three used to be respiratory illnesses. And from this reading, you're going to find out that number three has been replaced. So this is a study from May 3rd, 2016, John Hopkins Hospital, University and School of Medicine. And the study goes on to talk about medical errors now being the third leading cause of death in the U.S. Okay, so like I say, it has replaced the respiratory illnesses as number three. So I'm just going to go on and read this information to you from this article. And this is from May 3rd, 2016, article from I think this was posted, I'm trying to see where it was. It was in one of the journals here, the British Journal of Medicine, I believe. Okay, but it's from information from John Hopkins University. Okay, and so where you can get more information, you want to look up 10% of all U.S. deaths are now due to medical error. Look up the third highest cause of death in the U.S. is medical error. And medical errors are an under-recognized cause of death. So this is probably the thing that really prompted this study. Anyway, the article goes, it says, analyzing medical death rates data over an 8-year period, John Hopkins patient safety experts have calculated that more than 250,000 deaths per year are due to medical error in the U.S. This is their figure published May 3rd in the BMJ, that's the British Medical Journal, surpasses the U.S. Centers for Disease Control and Prevention, the CDC's third leading cause of death, which was respiratory illnesses. You know, respiratory illnesses due to, this was seen in the adult, due to disorders of smoking and the associated respiratory diseases. And that includes secondhand smoke, which killed at that time about 150,000 people per year. So John Hopkins' team says the CDC's way of collecting national health statistics failed to classify medical errors separately on the death certificate. So you won't see this on a death certificate that the patient succumbed as a result of, medical errors. It says the researchers are advocating an updated criteria for classifying deaths on death certificates. Now, this is a quotation here. It says incidence rates of death directly attributable to medical care going awry haven't been recognized by any standardized method for collecting national statistics, according to Martin Macri. He's a PhD and medical doctor, professor of surgery at John Hopkins University School of Medicine, and an authority on health reform. It says the medical coding system was designed to maximize billing for physician services, not to collect national health statistics as is currently being used. And so this is the number that you see on your your EOB, your explanation of benefits. When you get that back after having a procedure done, you visit the hospital, there are codes on there as to what their diagnosis codes, and there may be some treatment codes. That's a different, they're not talking about treatment codes, they're talking about diagnosis codes here. Okay, and so he goes on to say that the medical coding system was designed to maximize billing for physician services, not to collect national health statistics as is currently being used. Now, they've been aware of this. So it says that in 1949, Dr. Macri says the U.S. adopted the international form of used international classification of diseases. So that's ICD. This is what we use today. All doctors use the ICD codes. They're always updated. We're at ICD 11 now, 10 and 11 that we're using. Billing codes to tally causes of death. So at that time, it was under-recognized that diagnostic errors, medical mistakes, and the absence of safety nets could result in someone's death. And because of that, medical errors were unintentionally excluded from national health statistics, says Macri. The researchers say that since that time, national mortality statistics have been tabulated using billing codes, which don't have a built-in way to recognize incident rates of mortality due to medical errors or medical care going wrong. In their study, the researchers examined 4 separate studies that analyzed medical death rates in terms of data from 2000 to 2008, including one by the U.S. Department of Health and Human Services, Office of the Inspector General, and the Agency for Health Care Research and Quality. Then, using hospital admission rates from 2013, they extrapolated that based on the total of 35,416,000 hospitalizations, 251,454 deaths stem from medical error, which the researchers say now translates into 9.5% of all deaths each year in the U.S. Now, that may not seem like a lot to you. So we're talking about 250,000 people died due to errors or mistakes in medical facilities. I'm not going to be anywhere dismissive of the medical profession in this area, because there's more to this than just the stats would suggest. There are various reasons why errors are made in hospitals. There could be staffing issues. It could be a mix-up in prescription medication, procedures, orders. You're looking at, when we talk about staffing issues, it could be that there's not enough staff to work with X number of patients, overworked staff, especially like nurses working double shifts and whatnot. Every effort is made to cover any type of possibility of medical errors and poor judgment. However, mistakes are made, as you can see from these statistics. And what they want to do is try to make sure that the death certificate will reflect that this person succumbed to some sort of medical error, which at some point in time, I'm sure there's going to be litigation involved with errors of this type. However, there is another thing that's going on here. A lot of it could be due to patient contribution to some of the medical errors that occur. For instance, you talk to some of the nurses, talk to some of the staffing. What about people who go in to do or administer respiratory care for a patient who needs it? What about phlebotomists who may stick themselves as a result of the patient who is moving or fidgety and what have you? Well, if this patient is contagious with some sort of condition that requires some sort of extra gowning or protection. See, and all of a sudden now that needle's going to go through that. See, it might be something contagious. This is why you see certain patients who are restrained. Now, I would not want to be restrained, but could that be contributory to some of these errors? It's not to say that you are contributory to your own demise, but we know that 70% of all diseases are lifestyle illnesses. And so I've always stated that the medical profession is not designed to treat lifestyle illnesses. They are designed to manage and prevent the inevitable outcome, heart attacks, strokes. They can help you even if you are experiencing a heart attack and they catch it in time, or you have had a stroke, or you are going in and you present with symptoms of a stroke. They can minimize the effect of a stroke or a heart attack or save your life. That's emergency care. That is not the type of care that one would need for an acute situation. Those who are chronically ill would need the type of care that revolves around lifestyle changes. Certainly, 70% of all these illnesses are related to diet, not to mention smoking, drinking, the use of recreational drugs, lack of exercise, obesity. So these are some of the things that come up. Are these contributory to some of these errors that we see? So that's all I want you to think about. I'm not assessing blame to any group, or whether it's medical or whether it's you as the patient, but it's something for you to think about. But those numbers do reflect that there's a problem. The problem is definitely growing. There are certainly some people who are not necessarily at their best when they administer care for a number of reasons. They're human too. But I also want you to start to work on yourself as a potential patient. You can start to do things in terms of making sure that you have the proper foods. Now, I'm going to do another video because we're going to talk about food. One reason why I want to get you off meat is because you don't really know what you're eating. So you're eating something you think is meat. You eat beef, you might eat the DNA of about 250 cows. See, we don't really know the way the processing is done. You don't eat from is that your calf? Did you raise that cow? Then, only then will you know that you got the DNA of that cow. Did you feed it grass? Was it grass fed? Then, only then do you know that you won't have any B12 deficiencies because you raise it and then you process it yourself. So the cow is not contaminated with any added chemicals, hormones. Maybe the soil is pretty good, but you raise yourself. We no longer do that. We don't have that as an option unless you have to have a lot of resources in order to be able to do something like that. So I just want you to give this some thought, not just the title here, the information I gave you in terms of the stats regarding, but I also want you to take the responsibility of making sure that you're not contributory to these statistics and become a statistic yourself. Okay, best in health.